My name's Sue Abdullah and I'm employed by Derby Teaching Hospitals as the lead dementia nurse. I've been in post since January 2015, and prior to that I worked in professional development as a clinical nurse educator. I've been there for 15 years. I started my career here at Derby Hospitals in 1998 when I came to accident and emergency as a staff nurse, and prior to that I did my nurse training at the University of Wolverhampton and worked at Burton Hospitals in the elderly rehab department. The NHS definitely recognises dementia as a growing problem. We're all very aware that there is an elderly population and a growing population of older people, and I think it's definitely more prevalent now than it's ever been and will continue to be. And if we look at some of the statistics that have recently been released by the Alzheimer's Society, they tell us that in 2021 roughly around 2 million people in the United Kingdom will be living with dementia, and approximately 1 in 4 families will be affected by it. So it's something that, as a disease, it's definitely going to affect all of us that work in healthcare. From the perspective of the Royal Derby, we have lots of sort of strategies and projects that are ongoing, lots of work that we're looking at to improve the experience of patients that come into hospital with dementia, not just patients but also supporting staff that care for those people with dementia, and also support for the families and the carers. So examples of things that we're doing: we have a dementia action group which is chaired by our deputy chief nurse, and we meet monthly. And we have a lead clinician, a consultant for care of the elderly, who also sits on that group. We work very closely with external agencies such as the Alzheimer's Society, Making Space and Derbyshire Carers Association, and they have representation on that group. Obviously there are nurses that sit within the group as well, and we also have user representation. And what we do as a group is look at where are we as an organisation and where do we want to be, what are our aims and objectives. We work very closely towards the sequin target, and we've just had a relaunch of the sequin, bearing in mind that the new sequin for 2015-2016 has just come out and is going to continue to provide us with standards of care that we need to meet over the next 12 months. From the perspective of our ward and department areas, we have a number of wards within our DME division who have sort of done a makeover on their day rooms and created reminiscence rooms. And that's included having old-fashioned furniture in there and chairs and radios, and actually just made it a much more homely space for patients with dementia. And actually it's not just for patients with dementia, but it's for any patient that wants to sit and actually use that space. And as part of that, what those ward areas will do is to run memory cafes on a fairly regular basis. So they will bring patients that are able to come into that space together, and they will put the radio on, and the staff, if they have enough of them to be able to support that, will also join the patients in there. From an environmental point of view, we work very closely with the facilities department to look at making our environment better for people with dementia, and that includes making sure that we have accent coloured walls so that they can wayfind much more easily. We have invested in new signage, we've invested in actually changing the environment to a degree by putting new toilet seats in place and things like that. And actually Ward 205 is our care of the elderly orthopaedic ward, and they're actually in the process at the moment of removing one of their nurses' stations completely and actually having a social seating area put in for people with dementia who perhaps need to be supervised more closely, so that actually the nurses can be doing the things that they need to be doing, but also having any patients that might need to be sort of supervised close by. Some of our projects for the future at the moment include, we're just about to pilot John's campaign, which is, as you may know, is a campaign for Dr. John Gerard, who unfortunately died with vascular dementia, and his daughter's campaigning for hospitals to allow families and carers of patients with dementia access to the hospital ward over a 24-hour period. And that's to not just about extended visiting, but it's very much about improving the experience of the person with dementia and actually supporting the healthcare staff as well. So from the point of view of the trust, then we want to implement John's campaign as far as possible, because what we want to allow is families and carers to come in and support their relative who has dementia, and also support the healthcare staff in the delivery of nursing care and nursing interventions. Another initiative that we're looking at is implementing dementia-friendly wards and departments, and what we will have is almost like an accreditation process for ward and department areas to apply for, and it will include lots of things around the environment. It will include things around the levels of staff and the numbers of staff and whether they're trained, and we'll look to have dementia champions and dementia friends in each of those areas, and that's something that I'd like to try and sort of have in place probably within the next 12 months.